these are our mothers, our brothers, our sisters, people who have had to travel abroad due to deaths in the family or end of life care. To hear the conditions that they are being subjected to is absolutely wrong. And I think that, again, to reemphasize, now is not the time for leisure travel. People should not be traveling for leisure purposes. But people who are being subjected to these circumstances now, they also need to be defended, and the government is not doing that.
The Conservatives want the government to scrap mandatory hotel stays for people landing in Canada. Right now, international air travelers have to get a COVID-19 test when they arrive, and they're required to quarantine in a government-designated hotel while they wait for their results at their own expense. In the week since these measures began, there have been concerns about the conditions and safety of some hotels and complaints from people who want to be exempt from the rules for compassionate reasons. The Primetime panel is back to talk about this. Shachi Kurl and JP Tasker. Our guest for this discussion, Dr. David Poon. He's the founder of the Faces of Advocacy, an organization that focuses on reuniting binational Canadian families. Hi, David. Good to have you back with us. Let me start with you before I go to our panelists, and just from the perspective of, look, the government here has been discouraging travel for a while. There were calls for them to do more, and so they brought this system in. Do you understand the motivation, and where do you see the gaps?
Our tagline has become discourage vacations, not families. The basic idea is the equivocation of someone being with their dying relative, someone to attend a funeral, the need to be with family, the equivocation of that with going partying in Cancun. These are two separate areas and two separate things, and I believe that that should be considered when developing a policy to manage COVID-19. Essentially, we want to make sure that Canadians know that we're not trying to get their families sick, nor do we want our own families sick. We'll follow public health guidelines. But if there is a way to decrease the burden and challenge happening to Canadian families, either by allowing them to safely quarantine at home or finding an alternative method with the pre and post testing, we ask the government to consider that.
JP, there's a couple issues here. The first is what David highlights, and that is that there are a number of people who have sought exemptions, and there is a list of exemptions they should qualify for, but for some reason don't feel like they're being applied in a uniform manner. And then the other side of it is the conditions that some people are facing when they get to these hotels, regardless of whatever circumstances brought them there. There's some worry about those conditions as well.
Well, I mean, anyone who's in these hotels should expect some degree of safety. And we've already had incidents reported publicly in the media. I did a story on it a couple days ago. A woman was sexually assaulted in one of these hotels. So there are questions rightfully being asked about the level of security in these places. Another horrifying story, of course, out of Oakville, Ontario, where a quarantine officer showed up at a woman's house, demanding some bogus fine and then assaulted her before taking off. I think there are questions to be asked about the kind of people they have working as quarantine officers. The Prime Minister announced this program at the end of January, and then they stood it up at February 22nd. It took effect. That's lightning fast in government speak, in government time. That's very, very quickly in the best of times. So there's questions to be asked about whether they cut some corners on this. Are they relying on some questionable outfits to do this sort of quarantine work? And I suspect there will be more cases like this reported as we move forward. But at the same time, I find it really hard to argue against this program right now when they have the new variants circulating out there outside our country, inside our country, but we don't need to be importing any more of them. And I don't really know if we've developed a program, a solid alternative to this quarantine method at this point in time to keep those new cases of the COVID-19 variants out of our country. We know anecdotally that following through on the quarantine before this mandatory hotel piece was introduced was spotty at best. And, we need at least some mechanism, I think, in place to ensure that people who are coming into our country get the proper testing, isolate appropriately for the 14-day period, for that we don't see a massive spike in, for example, the South African variant, which has proven to be vaccine resistant. So I'm sympathetic to some of the concerns that have been raised about the conditions, but I don't see how we scrap this all together at this point in time.
Yeah, the focus has got to be, Shachi, you'd think, on the federal government to improve the program, right? To address some of these concerns if they want to maintain it.
Hasn't that sort of been the story again of the last 12 months in terms of the accountability and the spotlight on the federal government? Not necessarily what they're doing, but how they're doing it or not doing it. And, really important to remember the context here. About 6, 7 weeks ago, we found that 60% of Canadians wanted to close the border altogether. Obviously, you can't do that, but it did indicate that there was a high level of concern coming out of Christmas, coming out of people popping down south for vacations, really worried about not just worried about potential spread, but I think also feeling like a little bit of a I can't go. How come you get to go? So now we're into a place where the federal government is trying to achieve a couple of things. Right now, they're trying to dial up the point of pain for people who consider traveling, and they're trying to really dial down risk of transmission from people who are coming back into the country. In that, I think what's missing, and clearly what's missing based on both what's been happening at some of these hotels, but also the situations that some grieving relatives have been experiencing, is there is a lack of a common sense obviously mechanism. Obviously, if you're in a situation where somebody is coming back from a funeral or end of life care and they can prove it, this represents a fairly small slice of travelers altogether, by the way, and travelers have already really dialed back their own plans. This is also about getting the country, particularly Quebec and Ontario and other places where people are desperate for some sun and for some warmth, to past the spring break point, past the point where families would be planning to travel, wanting to travel, tempted to travel, get them past that, get more vaccinations done, and then maybe look at this. Do I think, if I'm a guessing person, that we're going to be seeing this kind of requirement months from now? No, I don't. But in the meantime, it just seems to be another very ham-fisted rollout on part of the Trudeau government, which seems to be doing a lot of ham-fisted things in terms of the way they've been reacting to this crisis. It's never the intention. It always seems to be the delivery or the operation.
And David, I should qualify that there are certainly questions for the federal government, especially where your endeavors are concerned. A lot of this is also about the hotels themselves, right, which have some jurisdiction over the issues that people are facing there. But still, at the end of the day, it's a policy the federal government brought in, and so the questions are being directed their way. On the program itself, is there a way to improve it from your perspective without scrapping it completely?
So I want to make it very clear that the person who bravely shared her story about sexual assault is one of our plaintiffs in our charter challenge. If the question is keeping Canadians safe, we failed in that regard. And for us to continue this without knowing how to keep Canadians safe is terrible. We cannot continue that way. So the most important thing right now, in addition to keeping Canadians safe at the hotels, is to keep Canadians safe from a public health perspective. Can the government produce evidence that home quarantine is worse than hotel quarantine? If it is definitively 100% shown that home quarantine will not keep anyone safe, that's a different argument. But the challenge is there's no evidence produced. Now, in the event that it is produced, how about giving exemptions to families in terms of the cost? For example, Olympic athletes are currently exempt from the cost. Is playing a sport more important than being with your dying relative?
Right. So you think, could those exemptions, I mean, there are exemptions, I should say. There is a list that should apply to, for example, people coming for a funeral or going to spend their the last days of a loved one's life. But what we have heard from some people who have written to our newsroom is they don't end up qualifying for it. They're confused why. Like, it doesn't seem to be a uniform application.
In the past week, I can name 3 instances where someone had to come back for a dying relative, no response from the federal government. Someone went to a funeral, came back, was not exempt from the hotel. There are a number of instances like this, so the execution is quite flawed. But even then, why are we burdening them with an extra cost at an already difficult time when Olympic athletes are exempt from that cost and home quarantine is not definitively shown to be worse than hotel quarantine?
Okay, I'm going to leave it there. Thank you, all 3 of you, very much. Shachi Kurl, JP Tasker, and David Poon. Appreciate the discussion. A couple of things to update you before